Dr. Theodore Henderson with Neuroluminance Brain Health Centers, talking to you today about SPEC scans. There's a lot of interest in SPEC scans these days, and there's also a lot of controversy. So there are plenty of naysayers out there that say, oh, SPEC scans are completely useless. They don't tell you anything about the brain. There's no research to support SPEC scan. In fact, I know that there are so many research studies that there are over 200,000 subjects who have been in SPEC scan research studies. I know because I'm the author on some of those articles and did some of that research. And my collaborators and I have really been pushing the field forward, along with people in Korea and Europe and South America, all over, who have been pushing the science forward, because the science of SPEC is now quite solid. And so don't listen to the naysayer doctors who express an opinion if they haven't read the research. Follow the research. Some of you may have gotten a SPEC scan and you got your report and you go back to your doctor and the doctor says, I don't know what to do with this. Part of the problem is that doctors and psychiatrists are taught that psychiatric diagnoses are this list of things in a book called the DSM-5. Well, that list of symptoms for a diagnosis were made up by a committee. They are not based on the brain. So what we see in the brain is sometimes different from what they say might be there. So there can be 2, 3, 5 types of depression. There can be 2, 3, 4 types of brain problems that present as ADHD. For example, if you get a traumatic brain injury that hurts your frontal lobe where executive function lives and impulse control lives, do you really think that you're not going to look like you have ADHD? I mean, come on. Yes, it'll look like ADHD, but it in fact is a traumatic brain injury. It needs a different form of treatment. So what SPEC scans do is they do not diagnose, they guide treatment. They help the doctors ask smarter, better questions. So SPEC scans have their place in psychiatry. They are not diagnostic. Nobody's saying they are, but they help you understand what's going on in the brain better so that you can treat the person better and you get a better result. And that's exactly what we do at Neuroluminance Brain Health Centers. Dr. Henderson, signing off.